We want to ensure your safety, the safety of educators and all other personnel at the daycare center. Testing prevents the uncontrolled spread of the coronavirus. If everyone is tested, we can all remain safe. For this reason, from Monday, the 26th of April onwards, there is mandatory testing of all children attending kindergarten. That means if your child comes to the daycare center every day, you must provide 2 negative test results per week. Either an official test result can be submitted yourself, one that has been performed at a doctor's office, pharmacy, or testing center, or you may have your child tested at a daycare center by a trusted care provider. In the case that your child only attends kindergarten 1, 2, or 3 days per week, 1 negative test result per week is sufficient. We will now show you how the corona test is carried out at the daycare center. Firstly, all children go and wash their hands. Teachers also wash their hands and disinfect them. In a quiet, clean, but familiar room, the testing materials are unpacked. A short cotton swab is in the package. The swab is thin and the tip is only 1.5 centimeters long. The package also contains a jar with liquid and the actual test cassette. Children who already blow their nose are asked to blow their nose without blowing it properly. It is good when the nasal secretions hang in the front of the nose. For younger children, the educators will carefully and gently insert and turn the cotton swab in the front nasal area. This also involves touching the wall of the nose. This does not hurt. There is a slight pressure, but the children are distracted. With the older children, preschoolers, the children will also perform this themselves. The educators provide support and make sure that the cotton swab is not inserted too far and that the children turn the swab often enough and correctly. This process is done for both nostrils. The cotton swab is inserted into the prepared tube. The educator ensures further that the correct test collection procedure is carried out. As parents, you will be informed directly if this result is positive. In this case, your child has a high probability of having the coronavirus and must go directly home. In this case, we will call you directly. The child will be separated from the other children. Your child will, of course, remain under supervision until you pick him or her up at the facility. For example, in the garden or another room. After that, the child is to do a PCR test in a corona testing facility. Until the result is in, the child must stay at home for the complete duration. If the PCR test is also positive, the health department will call you and explain what this means for you and your child. We thank you for your understanding and support. If you have any questions, please contact your kindergarten management directly.